What are clear aligners and how do they work?
Clear aligners are little devices that are used to straighten teeth. It looks something like this. We have a model of patient's teeth with one of the aligners. They are clear, very hard to remove actually. The harder the better, so they stay well on the teeth. And there is the aligner model. So it's a very thin plastic tray that simply slides over the teeth and starts making them straight. Every aligner is slightly different than the previous ones, and we start with a crooked teeth. At the end, we end up with nice straight teeth. They come usually prepackaged individually in a baggies like that.
How often are aligners changed?
It is patient dependent. Most of the time, we wear it for 1 to 2 weeks. It depends on a patient. If the patient is really good with the wear of the aligners, usually a week suffices. If the patient doesn't wear it all the time, which is on average should be 22 to 23 hours a day, then we might go for 2 weeks or even 3 weeks. In general, young, healthy person, 1 week should be enough because things change faster. If somebody's a little bit older, has some medical conditions, it may take even 3 to 4 weeks per aligner.
Can I eat while wearing aligners?
Aligners should be taken out for eating, for drinking, especially hot beverages, because it may damage them. And we also take the aligners off for cleaning teeth. Otherwise, they should be on all the time. As I mentioned, it should be there for at least 22 hours a day for them to work. The more, the better.
Should I sleep with aligners in?
Oh, definitely, because that's on average 8 to 10 hours a day. So definitely should be sleeping with the aligners. That helps.
How do I clean and care for aligners?
For the most part, it's enough to rinse the aligners with lukewarm water, brush them a little bit, and they should stay clean. Normally, you only wear them for 1 to 2 weeks and then you get a new aligner set. So that suffices in most cases.
Will aligners change how I speak?
It will straighten them. Now, is it going to have any derogatory effects? Well, if you use your aligners while you're eating, drink, for example, sugary drinks like soda, have food debris left over, and then you put the aligners on, yes, it can harbor the bacteria and you could theoretically get cavities and gum problems. So it's very important to keep the aligners clean and the teeth, of course.
How often are checkups needed during Invisalign treatment?
Most of the time, it can vary between 4 to 8 weeks. On average, a person wears the aligner for 1 to 2 weeks at a time. So again, depending on the patient, how often, how complex the case is, and what's your ability to take care of the aligners, it's every 4 to every 8 weeks.
What are the benefits of Invisalign versus braces?
The benefits are quite clear. Literally, the aligners are transparent, so for the most part, people don't notice that there is anything in their mouth. They're also easier to clean. With the aligners, it's very easy to brush, to floss the teeth. With braces, there are wires, so it's much harder to get under it. Also, there is no brackets to fall off, no wires to be broken or bent. So from that standpoint, aligners are the clear winner, literally again.
How do you choose between Invisalign and braces?
Generally speaking, Invisalign or any aligners are used in a more easy cases, and braces with a standard approach would be used in a tougher cases where there's lots of crowding, very narrow jaws, and people need a lot of not just tooth movement, but also bone expansion. So aligners are good for the little bit easier cases. Having said that, in the last few years, there's been lots of progress, and aligners can actually do quite a bit of the heavy duty work as well. One of the particular cases where the braces are better over aligners is when we're dealing with jaw problems and the jaw needs to be aligned in a particular spot. In these cases, the braces, because there is direct tooth-to-tooth contact and no trace sitting over the teeth, are much better. So the more difficult cases where the jaw alignment is of uttermost importance, that's where the braces would be used. In majority of the cases, we can treat people with aligners right now. So that's the progress that has been made over the past few years.
Is Invisalign covered by insurance, and what's the cost?
Invisalign aligners, they can vary in price. In our office, the very simplest, easiest cases can start at about $1,000. The very difficult, extensive cases can range up to even $8,000 to $10,000. So we can get the mouth fixed up in 2, 3, 6 months, or some cases can go on for as much as 1.5 or 2 years. Again, depending on complexity.
Is there anything else you'd like to share about clear aligners?
In general, it's good to mention that aligners and Invisalign are good for the aesthetic cases, people who are more on the go, where the oral hygiene is a little bit more difficult, because braces do take some extra effort, extra flossing, extra time that's needed to clean. Invisalign and aligners in general are much more easier to take care of. Also, for people who are in the marketing industry, in movie business, etc., where the smile is important, Invisalign may be the way to go. And for the very difficult cases where lots and lots of work is needed, some major expansion, etc., in those cases, the braces would be the choice.